And in England, junior doctors have begun a 6-day walkout.
That's right. This is set to be the longest strike in the National Health Service's entire history.
Doctors are fighting for higher pay amid steep inflation. Tens of thousands of patients are now facing canceled and postponed medical appointments. The latest strike is putting even more pressure on the public health service, which is already dealing with a record high backlog.
CBS News foreign correspondent Ramy Inocencio joins us from our London bureau with more on this. And Ramy, I know for folks in England, the NHS has been this cherished thing. They pay taxes to use, but it's also highly maligned because of some of its inefficiencies. For the uninitiated, just break down for us the medical structure there in England and the roles that these doctors fill.
Sure, Errol. Well, you know this personally, I know, but junior doctors here have been compared to interns or residents in the United States, and they have up to about 10 years of experience, from someone who could be fresh out of medical school to someone who's been serving as a doctor in a hospital, but under a senior doctor. And the reason there's so much frustration and anger right now is because there are about 75,000 of them here in England, and they make up about half of all hospital doctors. So without them, the services of the NHS slow down. Now, they can admit patients, make diagnoses, request blood tests, but they can't do surgeries alone, but they can assist other doctors. But basically, if you ever need to come to the NHS here, heaven forbid you don't have to, but you'll likely be seen at some point by a junior doctor. They are really the lifeblood of the industry here that make it run well or make it run horribly.
So, Ramy, given how crucial they are, what points have caused these negotiations to stall?
Sure. It's all about the money, right? They are demanding a pay raise of 35%. And in an absolute kind of way, when you look at 35%, you might pause there. But their argument is that the raises they've been getting ever since 2008, and they have been backdating it, by the way, for the past 15 years. They say that this hasn't kept up with inflation. Now, the British Medical Association says that junior doctors, they claim junior doctors got a pay cut of 26%. That's in terms of the real pay and accounting for inflation. So they're saying this. They're billing this as a restoration instead. But one thing, there's likely an issue with fairness with other healthcare workers. And I say this because last year, NHS nurses, they agreed to a 5% pay raise. Consultants, which are more advanced doctors, they agreed to a 13% pay raise. So again, bringing up that 35% pay raise demand from junior doctors, that's nearly 3 times as much. So if there is the acceptance of this 35%, we might expect that others, nurses, consultants, might say, hey, wait a minute, we need to go back to the drawing board on this one.
And as this protest kicks off, I mean, 6 days is an eternity when it comes to health care. How might patients be impacted, and what could the long-term damage be?
Sure. Long-term looking ahead, but I also want to say looking backwards, it already has had its impacts, Errol. We've been talking about this for the past year, about strikes with doctors, with postal workers, across the board, many industries here in the United Kingdom. This isn't the first junior doctor strike, and with the nurses' strikes and consultant strikes, there are more than 1 million visits that were canceled in just the past year alone. And wow, we have numbers coming out from Christmas holiday, the Christmas holiday season. About 86,000 visits were canceled there. Some studies have also been done on past strikes. This is specifically with junior doctors. And there's some good news here. That the basic finding is that while elective surgeries, surgeries that you don't necessarily have to do, those were canceled or postponed, but it may not have impacted mortality. But on another side, another finding is that strikes have had negative consequences potentially for minority groups, and here in the UK, the black community more so than others. So the strike affects so many, but it can affect, and it does affect some worse than others.
All right, Ramy Inocencio, thank you.
Thanks, Ramy.
You bet.